The surgeons found at the operation that he had a malignant brain tumor called a glioblastoma, and it's not good news. There are different grades of malignancy with these kinds of tumors. They're graded from 1 to 4. 1 and 2 are generally considered excuse me, to be relatively benign. 3 and 4 are more aggressive. Glioblastoma is a grade 4. It's the most aggressive of this class of tumors. It does several things. It infiltrates oftentimes what appears initially to be a small area of tumor is really just sort of the tip of the whole problem. There's often microscopic spread of the cells through the adjacent brain tissue. As these things grow, they have mass effects, so they start compressing normal brain tissue, displacing normal brain tissue. They can hemorrhage. They affect blood vessels, so they can hemorrhage. And I'm suspicious that probably in Senator McCain's case, the tumor probably did cause a hemorrhage, and that's what caused the first concern about a blood clot, as they phrased it. The median survival after diagnosis is on the order of 16 months. And there are some long-term survivors, but it's generally hard to treat, aggressive. I said before that typically the cells have infiltrated through the brain tissue, so it's much more extensively present than one might think from the initial imaging tests. And so surgeons usually try to take out all the visible tumor, but generally understand and expect and know that they're leaving behind tumor cells. And radiation is typically used in conjunction with the surgery. The radiation is actually probably the more effective treatment in terms of eliminating the more widespread tumor cells, and then often there's chemotherapy as well. But even with all these treatments, and there are some long-term survivors, but the prognosis is what I said. Most people don't survive significantly more than a year. To put it really basically, if someone has a cancer in one lung, you can take out a lung. You can't take out half the brain. So it's where it is a problem. There's a limit to what you can resect. Again, these cells seem to be very resistant to the agents that we have for treatment now. So the radiation is good, but generally we don't think radiation is, we know that surgery is not going to cure people with this diagnosis. We don't expect radiation will cure, but sometimes people are very fortunate and do very well after that. These tumors are chemotherapy resistant as well, and so even with the best conventional treatment we have, the median survival remains under a year and a half.